Hello and welcome to GAPNA Chat, an official podcast of the Gerontological Advanced Practice Nurses Association. GAPNA Chat provides interviews and discussions with GAPNA leaders and members of the gerontological healthcare community and will focus on advocacy, policy, education, professional development, research, and clinical care for older adults. In this episode, Dr. Cassandra Von Ness, a gerontological nurse practitioner and member of the GAPNA communication team, talks with GAPNA past president Dr. Deborah Dunn, Dean of the Graduate School and a professor of nursing at Madonna University in Livonia, Michigan. Dr. Dunn discusses her inspiration to become a gerontological nurse, GAPNA's partnership with the United Health Group Foundation, findings from the United Health Group's senior report, and how staying curious, appreciative, and eager to take on new challenges helped propel her in her career as a nurse. We are pleased to present Dr. Von Ness's interview with Dr. Dunn.
Hello all, this is Cassandra Von Ness, your host for GAPNA Chat. Our guest today is Dr. Deborah Dunn. Dr. Dunn currently serves as Madonna University's Dean for the Graduate School and Director of the Center for Research and a full professor. Prior to her appointment as Dean, Dr. Dunn served in Madonna's College of Nursing and Health as Director of the Nurse Practitioner Program and nursing faculty member for over 20 years. She has taught across the curriculum and has led several revisions, including the revision of the nurse practitioner curriculum to adult gero, and developed a dual track in advanced hospice and palliative care. She is a certified gerontologic nurse practitioner. She's also certified as a gerontological specialist, an adult clinical nurse specialist. Dr. Dunn has more than 20 years of clinical work as a GNP. She holds a doctorate of education from Eastern Michigan University, a postmaster's gerontological nurse practitioner certificate from University of Michigan, an MSN as an adult clinical nurse specialist with a minor in nursing education from Wayne State, and a BSN from Eastern Michigan University. She currently serves on the board of directors for Angela Hospice and Marywood Nursing Care Centers in Livonia, Michigan, and she's a member of the steering committee for the National Volunteer Community Care Corps. Dr. Dunn is a past president of the Gerontological Advanced Practice Nurses Association and a member of the Strategic Planning Committee and program director for the Leadership Institute. Her prior national positions include Director at Large, Chair of the GAPNA's Writer Group for the Consensus Statement on the APRN Gerontological Specialist, GAPNA Newsletter Editor, Chapter President's Committee, Research and Education Committees, and she is a past recipient of GAPNA's Excellence in Education Award and is a 2021 recipient of the Distinguished Educator in Gerontological Nursing Award from the National Hartford Center for Gerontological Nursing Excellence. Welcome, Dr. Dunn. It's so nice to have you. I guess from your introduction, you're a lifelong Michigander.
I am. Thank you so much, Sandy. It's great to be with you today. Yes, I am a Michigander, and we always hold our hand up and show you the mitten to tell you where we're from. That's one of our key things here in Michigan.
So let's start with a reflective question. Imagine you're having a conversation with yourself after your BSN. At a time you were in pediatrics. Why geriatrics?
That's wonderful that you asked, Sandy, because one of my sayings today is, if you're not in pediatrics, you are in geriatrics, because our elders are everywhere. But it's just such an amazing journey, this career of nursing and advanced practice nursing. And my career really emulates that you can do anything and go in any direction that you like with your career. And I did start out early on as a medical surgical nurse. I was on a surgical floor on the midnight shift, and I got on day shift by accepting a job, saying yes to a job that was a med-surg rotation 1 month and then to pediatrics next month. And many people didn't want to do that. They did not want to take care of children, or if they wanted to take care of children, they didn't want to rotate to adults. So that's what got me on the day shift. I said, yes, I'll do that, and did the rotation. It was just a beautiful thing. And I learned a lot. It was general medical surgical care of children. And then, of course, older adults were just beyond the doorway. And I did med surg there early in my career.
With your first master's, you worked as a clinical nurse specialist. What led you to pursue the GNP as a nurse practitioner?
During the 80s, the clinical nurse specialist was the way to go. That's where everyone was being pushed to go. DRGs had just hit the hospitals. We needed these nurses with advanced education to kind of help us move people efficiently through the hospital, make sure they're getting the care that they need, and make sure that their length of stay is not too long and they're moving through the hospital. And then we had several roles you could play as a CNS. So you could be a manager, you could be researcher, you could be teacher, you could be clinician. So I had the good fortune of really being a clinician who also did nursing education. So I was in the hospital working as a nursing educator, doing the new orientation of staff, doing the critical care classes, teaching ACLS, BCLS, all of that good stuff. And also being able to get called upon when there were problems in the ICU that they wanted to solve. If somebody's chest tube wasn't working right, they could call me and I'd come up and look at it. If the hemodynamic monitoring line, the pulmonary artery catheter wasn't working right, they could call me, I could come up and do that. So it was a really great time. I was well suited to that. And as I got a little bit older in my career and I had my daughter, I then cut back a little bit and I was nursing contingent and then was convinced to teach at Wayne State University. So I started teaching a critical care class at Wayne State University and doing clinical rotations with students there. So now I'm seeing more and more primary care providers down at the Detroit Medical Center. So I'm interacting with people at Wayne State and at the Detroit Medical Center that are doing primary care folks. I went on to take a full-time job here at Madonna teaching and just was really moved to take up a nurse practitioner role. And because I had the adult CNS, I thought I should specialize. I love older adults. We need people to take care of them and be able to take care of them across settings. So I went to University of Michigan because they had the Gerontological Nurse Practitioner Program at that time. And I did that postmaster's certificate there. Took up working with two colleagues that I had known for years and years at the hospital and became their first nurse practitioner. That was wonderful. It was new to them and new to me, but we had grown up kind of baby doctors and baby nurses together in our first career there at the hospital. And I began seeing their patients in long-term care, post-acute care, and assisted living environments and just absolutely loved it. And I worked with them for 23, almost 24 years, doing that as well as teaching.
It was certainly a time when we needed to make sure there were enough providers to provide primary care to populations.
Absolutely.
So let's shift gears for a moment. Could you share with us a little bit about the partnership of the United Health Group Foundation and GAPNA and how that originated?
Absolutely. We are so fortunate at GAPNA to have several members that are working with the United Health Group. So our members, of course, love GAPNA and they love their employer and could kind of see a marriage there, a good way to partner. And we started in 2018 with our national annual conference. One of the members, Sue Mullaney, who works at United Health Group, said, a lot of people have asked me how they can learn more about interacting with their congressman. We're here in Washington for our national conference. I'd be happy to do a session on how to interact with your congressman. That was wonderful. She did that session for us in DC, and all of us learned a lot about approaching our congressman for priorities, and that, of course, being full practice licensure for nurse practitioners, so that we can get more people access to care. And then some specific other things that we were working on at that time, which was to convince CMS that nurse practitioners should be able to order home health care services. That a lot of times patients are not able to access home health care services while they're waiting for a physician to sign an order. And that advanced practice nurses are certainly able to do that assessment. So that was one of our priorities. Another one we're still working on as nurse practitioners being able to order diabetic shoes. We see that our patients are not able to get the diabetic shoes that they need. And we know that these shoes prevent foot ulcers. So one of the things we were advocating for on the Hill there is our congressmen support us and support that change in CMS, that nurse practitioners would be able to write an order for diabetic shoes. And I think we were pretty convincing because we have the data there showing that one foot ulcer costs about $60,000 to CMS. So it only makes sense, not only for the good of the patient and their health, but also from a financial perspective to CMS. So we were really convicted that year and led to think deeply about our role advocating health policy as nurse practitioners, and being able to be with an expert who was our member, Sue Mullaney, who also is at United Health. We were able to kind of marry that together. And then from there, United Health Foundation said, this is just wonderful. You played an important role in healthcare delivery. You are really smart advanced practice nurses. We would like to work with you and advance the well-being of America's seniors. How about getting together with us and looking at our America Health Ranking Senior Report and how we collect the data, how we organize it, and then how we report on it. And maybe these findings will resonate with you, and you'll even be able to tell us some stories about patients you've taken care of that have experienced some of these things that are being demonstrated in the data. So that's a long way around, but I hope that gives you a sense of how we got to be involved with United Health Foundation.
Included in the senior report are some of the drivers or the determinants of health that, has been in the news a lot. Social and economic factors, physical, environmental, clinical care, behaviors that influence our model. What can the gerontological advanced practice nurse take from the senior report for their practice?
That's a great question, Sandy. One of the things I think also that both GAPNA and United Health Foundation understands is that we've got 50 million seniors in the U.S. today. It's a big group of people needing a lot of care. That's a 45% increase over the year 2000. And we're looking at 98 million, I think, predicted by 2060. That's 24% of the population. So we see the numbers growing, and the health report of the senior rankings show those numbers growing as well. They collect a lot of data. There's 160 health measures that are collected, and it's a state-by-state comparison. And the thing about the data, there's so much that you can look at. For us as nurse practitioners, clinicians taking care of patients, we can hone in on some very important findings. One is the level of home health care use that we see increasing in the report. It shows us that. We sort of know that intuitively because we're working with patients. But over the past 6 years, home health care use for our seniors has increased by 44%. So that means for us, we know where to find them and where they're going to need help. We understand that we're going to have to prepare ourselves for the home health care environment and be able to see people in the home and take care of their health care needs. The other piece to that I'd also like to touch on is the increase in hospice care that we see in the report. It shows us that Medicare hospice benefit is being used by more and more seniors, and that it's in all 50 states. There isn't any disparity. It's an uptick in all of the states. So no matter where you're working, us as clinicians, we need to be in tune with that and also be able to help our patients access hospice and palliative care as they need to. There's a really important finding in the senior rankings report on mental health, mental distress, and depression. And unfortunately, we are seeing an increase in senior mental distress, depression, and suicide. So that's in both males and females. However, we see that males in the report are 6 times more likely to commit suicide as seniors. So this is a huge, important point for us as clinicians and for just community action folks to really look at interventions to help seniors with mental distress, mental health, and depression, and get interventions to them earlier so that they are not suffering with mental distress. The report also showed some really great things. And one of those was the Supplemental Nutrition Assistance Program, SNAP program. That's one of the health measures that the report covers. And it shows that seniors who qualify for the SNAP program are getting access to it. So we're seeing a decrease in food insecurity for seniors. And as you know, the pandemic has kind of thrown off all of the metrics. But even during the pandemic, we saw that seniors were getting access to SNAP. So we were afraid because of social isolation during the pandemic that our seniors would not have access and they would in fact have more food insecurity. But SNAP kind of ramped up efforts and we saw that was not a problem during the pandemic and that's improved. I think overall, things that the nurse practitioners and others can glean from the report are that we need to stay on top of obesity. Obesity is a growing problem, particularly in the young senior, the 65 to 74. So obesity, diabetes, staying on top of that with our seniors, and then excessive alcohol use. Those three things can really impact health in that young senior group, 65 to 74. And the senior report does show that those are the issues during that time period. So again, that informs us in our practice to pay attention and manage obesity, manage diabetes, look and ask the question about excessive alcohol intake, educate people on the negative effects of that. And to balance that with a positive, again, we see in the senior report that seniors in that 65, 74-year-old category actually do report better health than they have in the past. So people are answering the questions and saying, actually, I'm in pretty good health. I'm pretty functional. My mobility is pretty good. The other positive we see is that there are decreased rates of smoking. So the senior report is showing us that those efforts that we've been doing to try and have people quit and continuing to quit smoking, they're working. And seniors are reaping the benefits with better health because of lower rates of smoking.
So how often is the senior report compiled? I know that a lot of the numbers that we've talked about and reflected currently doesn't account for the pandemic, especially the mental health issues and things that we were really concerned about our older adults. So when will we see the next senior report?
Yes, so data is being collected. We did see, a 2019 and a 2020 senior report. We didn't see quite the marketing, I guess I'll say, or communication of that report as widely because I think United Health wanted to be really respectful of what's going on with the pandemic. And also, just from a data management point of view, really sit and think about how the pandemic is affecting the reporting of different statistics. And of course, there was a huge reporting burden on health throughout the pandemic, right? The states are having you report on infections and deaths and all of those kinds of things. So I think we're going to see a very robust report coming out next and perhaps seeing some of those state by state comparisons come back. I don't know that for sure. I hope that's not a cat out of the bag or incorrect, but it's a fabulous report. The website is amazing. The drill down that you can do in your own neighborhood. You can go by zip code. You can look at not just senior things. You can look at rates of asthma. You can look at pediatric problems. You can look at women and child issues in the other reports. But you can definitely see how your seniors are doing in your community by going to America's Health Rankings website and really drilling down into the findings in your own area.
This could be very important for program development, for grant writing, for lobbying your local agencies too. So I have a personal question. I was intrigued that you've adopted a culture of yes in your career. Could you, share with the audience a little bit about what that means?
I would be happy to, Sandy. One of the things that I noticed early on is that when people would offer a job position to me or offer an opportunity to write a policy in the hospital, I didn't feel I could say no. I said yes. And I always thought I should do this because I'm sure I'm going to learn something. It may seem like it's too big, but I'm sure I can reach out and get some help if the project's too big or the job might be too daunting. And it's really been helpful to have an attitude of just say yes. I've been able to move into various positions throughout my career. It's helped me learn so much, stay curious, stay appreciative. I think nurses do practice with an attitude of gratitude. So when they do get exposed to doing something differently or learning a new skill, we're very happy to do that. And we're very thankful that we've added another tool to our toolbox. So it's really been helpful to me in growing my skill and my knowledge and just being able to appreciate the huge diverse things there are to do in nursing and healthcare and the many skills that our colleagues have. I'm in awe of our colleagues in the healthcare and all the things they know, they do. And I think that comes from saying yes.
As a dean and educator, how do you balance that when you're talking to your students? And there's a lot of talk about a life balance where a lot of people are stepping up to say no more often. How have you learned that successfully?
I think that's a great question. And I can't say that I haven't overcommitted myself on many an occasion. But I do think that discernment of what will really be a win-win, what can I bring to the table, and then what can I take away is really important. That's why professional organizations have always been so important to me and why I've been in GAPNA for decades now, because the professional organization is a good place to say yes. You can plug in throughout your career a little bit, a moderate amount, or a lot in a professional organization. It allows you to get exposed to colleagues that you wouldn't have otherwise been exposed to. It allows you to be asked to serve on committees that you wouldn't have otherwise been asked to serve on and get involved in projects that you might not have otherwise been involved in. And in doing that, it enriches your career. It's a real give back when you're saying yes in your professional organization. I think probably anyone, yourself included, that you talk to about their involvement, for instance, in GAPNA, would say, it's been great. It's really wonderful because I've met this person or that person, or I've had the opportunity to write an article, which I never would have had that opportunity as a busy clinician. So I do tell students that they do need to say yes to doing things. For instance, precepting. When they get out and they start working, say yes to being a preceptor. Somebody had to say yes to precepting you, pay it forward. And you always learn so much when you're teaching something, right? It's always extra work, but it will be rewarding work, and it'll be rewarding opportunities when you engage in these different ways. You shouldn't say yes to everything. It's trying to have that reflective moment on, does this make sense? Can I contribute here? And can I also learn from this? I think that's important. We get out of school and we all think we don't know enough. How am I ever going to do this? It's that imposter syndrome. I don't know why you're asking me to help you with that. I don't know enough yet. But saying yes, you will learn what you need to know, and you will find out that you know and are more skilled than you probably are giving yourself credit for. And, you're a gift. You're a gift to the profession. You're a gift to the workplace. You're a gift in other people's lives when you do that. I had the good fortune the other day, a former student called me up and said, hey, we'd like to take you out to dinner. We haven't seen you. I haven't seen these students in probably 10 years. And I went out to dinner with 3 nurse practitioner students. And what was really awesome is they said, Debbie, look what I've become. You did this for me. Well, I played a small piece, in their education, but it's really wonderful. And that's what I think we can do for our colleagues and what we're doing in other people's lives when we say, yes, I'll teach that class. Yes, you can come to clinical practice with me. I'd love to have you. Yes, I'll do one more H&P, whatever it is. Yes, I'll serve on the committee. But then you have people come back, a decade later and say, it's really important what you did for me. That really helped me out. So I think that I probably gain more from saying yes, what I give or deliver.
And that's true. We don't often in the moment realize the impact of paying it back in our practice is going to have. You've served in a variety of capacities in GAPNA. What do you see for the future, for the next 40 years, as GAPNA celebrates their first 40 years?
I just see us getting stronger and better at what we do. I see us as an essential organization to promote excellence in care of older adults and to promote excellence in policymaking, because that's really where the rubber meets the road in terms of healthcare. It's in policymaking. What we do every day, taking care of patients, of course, is imperative, but it's the policies that are made that impact how we do it, when we can do it, and where we can do it. So I do see GAPNA playing a big role in influencing healthcare policy for older adults in the future. I do see, in my estimation, I think there will be sort of this renewal and rebirth of professional organizations. We have across the board seen people less likely to be involved in professional organizations, not so much in GAPNA because we have our partnerships, but folks are said not to be the joiners of persons from my generation. I do see that changing. The more and more I talk to new nurses and people in practice, they are looking to connect. So I do think probably as professional organizations, we need to do a little bit more outreach and make it very accessible for people to be involved in our professional organizations. You know, GAPNA, we were incredibly successful doing our very first fully online conference. And I was just stunned by how successful we were. We had a lot of nurses engaged. It was the accessibility. We hit the nail on the head and got it right, making it accessible for busy, modern clinicians. You know, so I do see GAPNA needs to work a little bit more in the future on that accessibility, making ourselves more and more relevant and accessible to the membership. And then, as I say, one of our big areas is honing in on policy and being influencers of policy, because that's what's going to make a difference for great care for our older adults and great practice for our nurse practitioners, you know, coming up and coming into practice. We want to have a practice world in a healthcare system where they love what they do and they never, ever want to leave it. They just want to do it for years and years, like you and me, Sandy.
And someone has to take care of us, right?
That's right. That's right.
So what's next for Debbie Dunn now?
Great things. I continue to be involved in professional organizations, and GAPNA is my heart, and I am involved in strategic planning. So I'm looking forward to that. I'm working with GAPNA on the Leadership Institute. So we're preparing leaders for the future, and we are preparing people to lead in GAPNA and lead in their own careers. We believe very strongly that nurse practitioners can be great leaders wherever they plant themselves. So we want to help people grow in that area. I've had great opportunities working with some local boards here in my community with Marywood Nursing Care Center and Angela Hospice. And I really treasure that work because I can help shape, you know, hospice care and long-term care and post-acute care for people in our community. So my philosophy has been kind of global, you know, think globally, but act locally and have impact. So that's really great. I'm super interested in telehealth. I don't know about you, Sandy, but I haven't had the opportunity to practice it. I had created my own app to help seniors be more accessible to their families, and I haven't been able to get that going. The electronic health record, people don't like you tapping into their systems, and
no, you need to stay in your lane.
Yeah, they don't care for that. But my whole thing is I wanted to create this so that I could get patients and their families in touch to reduce caregiver stress and to increase satisfaction of care on the part of the person who's in post-acute care or in long-term care. So I'm still going to continue to work on that. I'd like to find a way, you know, find a partner. I wasn't at all interested in making money. I'm interested in solving the issue of how distressed family members are when they can't see or be with their loved one. And this is pre-pandemic. I was seeing this when people were vacationing and they would say, Debbie, is it all right to leave mom? I feel terrible, and I would say, you can call me anytime. You can call the nurse station anytime. We're your eyes and ears. But they need to see mom. They need to lay eyes on mom and know she's okay. They need to get reports and updates that everything's okay. That's really where I wanted to go with that entrepreneurial way. I'll probably continue to work on that and see if I can make headway.
Innovation is important. Nursing can be innovators. It doesn't take a pandemic to get us to jump in the deep end. I'm practicing in Florida, and a lot of Michiganders come to Florida. So I know something like that would be wonderful for us to connect with family that's left up north.
Yeah, nurses get the practicality.
Well, thank you so much for taking time out of your day, Dr. Dunn, to spend some time with us.
And I thank you, Sandy. It's been great.
This is Cassandra Von Ness saying goodbye for now. Thank you again.
GAPNA Chat is owned and produced by the Gerontological Advanced Practice Nurses Association. All rights reserved. No portion of this podcast may be used without written permission. Dr. Deborah Dunn is Dean of the Graduate School and a Professor of Nursing at Madonna University in Livonia, Michigan. Prior to her appointment as Dean in 2013, Dr. Dunn served in the College of Nursing and Health as Director of the Nurse Practitioner Program and has been a Madonna University nursing faculty member for more than 20 years. Dr. Dunn is also a past president of the Gerontological Advanced Practice Nurses Association. Dr. Cassandra Von Ness is the Nurses Improving Care for Health System Elders Coordinator, Geriatric Oncology, at the Moffitt Center in Tampa, Florida. She is a member of the Gerontological Advanced Practice Nurses Association communication team and is a host of the GAPNA Chat podcast series. For archived episodes of GAPNA Chat and to learn more about the Gerontological Advanced Practice Nurses Association, visit gapna.org. You can also subscribe to GAPNA Chat on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found.